Hi everyone, welcome again to my presentation. Our topic is all about upper anterior ribs for PA projection and posterior ribs for AP projection. Our topic is upper anterior ribs, PA projections, and posterior ribs, AP projections. The anterior portion of the ribs, usually referred to simply as the anterior ribs, are often examined with the patient facing the IR for a PA projection. And the posterior portion of the ribs or the posterior ribs are more commonly radiographed with the patient facing the X-ray tube in the same manner as for an AP projection. In radiography of the ribs, the patient is usually examined with respiration suspended in either full inspirations or expiration. Occasionally, shallow breathing may be used to obliterate lung markings. If this technique is used, breathing must be shallow enough to ensure that the ribs are not elevated or depressed as described in the anatomy portion of this chapter. Rib fractures can cause a great deal of pain and hemorrhage because of the closely related neurovascular structures. This situation commonly makes it difficult for the patient to breathe deeply for the required radiograph. Deeper inspirations will be attained if the patient fully understands the importance of expanding the lungs and if the exposure is made after the patient takes the second deep breath. Okay, we are here in the upper anterior ribs for the PA projection. Patient positioning. So this is image is the PA ribs upright position. Position the patient for a PA projection either upright or recumbent. Because the diaphragm descends to its lowest level in the upright position. Use the standing or seated upright position for projections of the upper ribs when the patient condition permits. The upright position is also valuable for demonstrating fluid levels in the chest. Center the mid-sagittal plane of the patient body to the midline of the grid. To include the upper ribs, adjust the IR position to project approximately 1/2 inches or 3.8 centimeter above the upper border of the shoulder. Rest the patient hands against the hip with the palm. This one. Turn up outward to rotate the scapulas away from the rib cage. Adjust the shoulder to lie in the same transverse plane. While if the patient is prone position, rest the head on the chin and adjust the mid-sagittal plane to be vertical. To image affected ribs unilaterally, use a 30 by 35 centimeter image receptor for contrast improvement. For hyperstenic patient with wide rib cage, include the entire lateral surface of the affected rib area on the radiograph. This may require moving the patient laterally to include all of the affected ribs. Image receptor 35 by 43 centimeter lengthwise. We are using chilled gonads. Respiration suspend at full inspiration to depress the diaphragm as much as possible. Central ray, perpendicular to the center of the IR. If the IR is positioned correctly, the central ray will be at the level of T7. A useful option for demonstrating the seventh, eighth, and ninth ribs is to angle the X-ray tube about 10 to 15 degrees caudate. This angulation aid in projecting the diaphragm below that of the affected ribs. We are here in the structural shown. This is the PA ribs normal centering. And this is the 10 to 15 degree with caudal angulations. Okay. We have here the anterior ribs. Here, the 1, 2, 3, 4, 5, 6. Then this is the posterior ribs here. 3, 5, 7. The PA projection best demonstrates the anterior rib above the diaphragm. The posterior ribs will be seen. However, the anterior ribs will be demonstrated with greater detail since they lie closer to the IR. The following should be clearly demonstrated. First, through ninth rib in their entirety with the posterior portions lying above the diaphragm. First, through seventh anterior ribs from both sides in their entirety and above the diaphragm. In a unilateral examination, ribs from the opposite side may not be entirely included. Ribs visible through the lungs with sufficient contrast. Okay, now we are here in the posterior ribs, the AP projection. Patient positioning. Have the patient face the X-ray tube in either upright or recumbent position. When the patient condition permit, use the upright position to image ribs above the diaphragm and supine position to image ribs below the diaphragm to permit gravity to a unmoving patient's diaphragm. Center the mid-sagittal plane of the patient body to midline of the grid. Ribs above diaphragm. Place the IR lengthwise 1/2 inches or 3.8 centimeter above the upper border of the relaxed shoulder. This one. Rest the patient hand palm outward against the hip. This position moves the scapula of the ribs. Alternatively, extend the arm to be the vertical position with the hands under the head. Adjust the patient's shoulder to lie in the same transverse plane and rotate them forward to draw the scapula away from the rib cage. Shield gonads must be used. Respiration, suspend at full inspiration to depress the diaphragm. Ribs below diaphragm. So we are here in ribs below the diaphragm. Place the IR crosswise in the bucket tray with the lower edge position at the level of the iliac crest. This position ensures inclusion of the lower rib because of the divergent X-ray. Adjust the patient's shoulder to lie in the same transverse plane. Place the patient arm in a comfortable position. Shield gonads must be used. Respiration suspend at full expiration to the elevate diaphragm. If the AP ribs above diaphragm, the respiration is inspiration. If it's below diaphragm, full expiration. Okay. Central ray. Perpendicular to the center of the image receptor. Okay, we are here now in structural shown. The AP projection best demonstrates the posterior ribs above or below the diaphragm according to the region examined. The anterior ribs will be seen, however, the posterior ribs will be demonstrated with greater detail since they tie closer to the IR. So we have evaluation criteria for this AP projections. The following should be clearly demonstrated. For ribs above the diaphragm, first through 10 posterior ribs from both sides in their entirety. For ribs below the diaphragm, 8 through 12 posterior ribs on the both sides in their entirety. Ribs visible through the lungs or abdomen. In a unilateral examination, ribs from the opposite sides possibly not entirely included. Okay, that's all for today. I hope you gained some knowledge in this video. Hope you like it. Please like and subscribe for more updates and topic. Thank you for watching, guys.